So today we are pleased to be joined by Dr. Zachary Rubin. Dr. Rubin is a double board certified physician in general pediatrics and allergy immunology and the head of the social media committee of the American College of Allergy, Asthma, and Immunology. Thanks so much for joining us.
Thank you so much for having me.
So here we are, middle April, everything's blooming, and of course allergy season is kicking into high gear. We like to kind of be practical here at Health Day, so we wanted to talk about what you can do when those symptoms start to kick in.
So there's a lot of different issues at play when it comes to seasonal allergies, especially as tree pollen counts are starting to climb. In my area, it just started down in the south. It's been that way for at least a month. If you're in Texas, it's been since December, January with cedar fever. And so it's not just about medications, it's about lifestyle changes to reduce exposure to what you are allergic to. So as an example, if you have a tree pollen allergy, you may need to minimize the amount of time that you spend outdoors if you know that the pollen counts are going to be very high that day. And the pollen counts tend to be highest in the morning, especially if it's dry and windy. And you want to keep your windows and doors closed as much as possible to avoid the outside air with those pollen grains coming into your home. When you come home, you are going to collect pollen on yourself. So you want to make sure that you are changing your clothes as soon as possible, keeping your shoes in one place in the house, and bathing at nighttime so you're washing away all those pollen grains and also rinsing your nose. I've talked about this a lot, which is the idea that we brush our teeth every day. Why aren't we cleaning our nose every day? We have all these irritants, allergens, mucus in our nose. It's a dirty place. It's meant to trap all those things to help you from getting sick, but where is that going to go if you don't clean it out? You're going to either let it sit there because you get congested, it goes to the back of your throat through postnasal drip, or you're going to sneeze or cough it out. So there's a lot of lifestyle changes you can work on before even considering medications. And then when we talk about medications, there are a few options over the counter, but they're not all the same. So antihistamines like Benadryl, they treat primarily itching, runny nose, sneezing. It does not do a good job with nasal congestion or postnasal drip or headaches because there's a lot more inflammation that's going on that's outside of the chemical histamine, because when you take Benadryl, it blocks that chemical. Benadryl is also a drug that has a lot of side effects. It can make you very sleepy. And if you are older, you're at risk of having what we call anticholinergic side effects. So that could be feeling dry, having urinary retention, constipation, and taken at high doses can cause cardiac problems. So we try to move away from Benadryl and think about these newer second-generation antihistamines like Claritin, Zyrtec, Xyzal, and Allegra that have much less side effects. They last longer in your body, and they're either just as effective or more effective than something like Benadryl. So again, limited symptoms with those. Then you've got nasal sprays that either contain steroids or antihistamines mainly. So you have things like Flonase, Nasonex, or Nasacort that is a steroid that helps shrink down that tissue, takes away that generalized inflammation, but you need to start that medication several days before you expect symptoms because it takes time to change that immune response through the medication. So I often tell people in the Chicagoland area, we should start medications on Valentine's Day. Valentine's Day is a date with your nose because by the time you start it and then the pollen grains come out, the medication's working. And if you're proactive with your treatment plan, you are less likely to have symptoms because you've already prevented the inflammation from starting. If you start right when the pollen season starts, you're playing catch up. You have a much harder time getting the inflammation under control. So it's really important to start things ahead of time from when you know you're going to start having symptoms. Then there's also nasal antihistamines. The one that's available over the counter is called Astepro. It's a nasal antihistamine that can taste very bitter, so you have to be careful how you take it. So I often tell people, look down nose to toes, place that nozzle slightly up, but tilt it slightly towards the ear on the same side. You spray on both, and then you just breathe normally. Don't snort it, because if you're snorting it, it goes to the back of your throat, and if you're tasting it, you waste it. Plus, it's going to make you feel really nauseated if you taste that very bitter spray. But it's more fast-acting than something like Flonase because it's an antihistamine medication. Not quite as effective, but I find using both of them in combination can be very beneficial for many of my patients.
Yeah. So on the nasal sprays, I know a lot of people who have really bad nasal congestion and they use the nasal spray like it's their morning coffee or something, every morning and is that something that you recommend, or is it something they got to worry about?
Well, it depends on the person. So with children, if you're going to use something like Flonase, there's a theoretical risk that you could get more systemic absorption of the steroid, and systemic absorption of steroids at a young age could potentially stunt growth. And so it's a little bit of a controversial topic. A lot of the studies don't see that actually playing out long term, but it's a theoretical risk. And we try to minimize steroid use in children as much as possible and do more with less, is what I like to tell my patients. When you get older, you also start worrying about that increased exposure that's chronic over time. Could that cause cataracts or issues with glaucoma, as an example, with again, chronic steroid use? That could be a potential, but it's rare for something like that to happen. There's another type of nasal spray we didn't talk about that's a decongestant spray. So there's two main medications. There's phenylephrine, which think of Vicks Sinex as an example. And then there's also Afrin, which is oxymetazoline. They are very fast-acting medications that basically clamp down on those blood vessels in your nasal cavities to really relieve that congestion right away. And when you're really sick, it's not a bad idea to use it once in a while, but if you use it for 3 days straight or more, you increase the risk of developing this condition called rhinitis medicamentosa. Essentially, what that means is that your body becomes dependent upon the spray because you end up getting this rebound congestion effect where when you stop the medication, all of a sudden your symptoms get worse than they were before. And that can be difficult to manage. So it's important that people read the package labels on any medication they get over the counter to look at the precautions, warnings, and who may need to consider talking to their doctor before starting a medication.
Yeah, definitely. So you were talking about the phenylephrine. We read some stuff about the oral phenylephrine. Most people call it Sudafed or NyQuil. A lot of people I know, it's like, oh, I can't sleep at night, and you take that, and before I go to bed, maybe that'll help me get over my allergies. What's your recommendations on that?
Well, interestingly, there have been scientists who have petitioned the FDA for a number of years and finally got an audience with them that stated they looked at the newer data and found that oral phenylephrine is no better than placebo at treating a stuffy nose. And the reason why this is likely the case is the fact that when you take that medication by mouth, it's a different route of administration than spraying it in your nose. So you have to go through metabolism in your body and break down the medication. And by the time the actual active ingredient gets to your nose, there's almost nothing there. So there's medications like Sudafed PE. Any medication that says PE stands for phenylephrine. Pseudoephedrine, which is the real Sudafed, the good stuff that you get behind the counter, you have to show your ID, is a highly controlled substance because you can potentially make illicit substances out of it, which is why back in, I believe, 2005, they put a federal law in place to put that medication behind the counter. That's the only oral decongestant that's actually effective, relatively safe, and more widely available. But because they put that behind the counter, all of these pharmacies and stores started putting this phenylephrine orally, which is technically a decongestant, but when it's in its oral form, it's not effective. You need the nasal spray version of it to be effective.
All right. Well, this is certainly going deep on all the various methods to work when we're feeling the symptoms coming on. One of the things that I'm curious about, there seems to be some really exciting new research going on. We talked about treating the symptoms. Is there any way about treating the causes? I mean, you talked about stuff staying inside and stuff like that, but obviously spring, we don't want to stay inside all the time. I'm kind of curious what you're seeing, kind of new research, some of the new immunology stuff. What do you see out there in terms of, is there a way to develop natural tolerances to allergies? Is there something that's coming out there that can help people? Maybe we'll get a way to get around some of these allergies.
Yeah.
What do you think?
So what we have used as a tried and true method to actually cause what we call a disease modifying state, where you're treating the underlying issue, is called immunotherapy. So a lot of people have heard of allergy shots or allergy drops. And the idea is that we give you a tiny amount of the allergen and slowly increase the doses and the exposure over time in a controlled way to desensitize your immune system, meaning essentially the immune system gets bored of that particular substance.
Well, that's good when it comes to allergy, that it gets bored.
Yeah, exactly. Because allergy is an abnormal immune response to a foreign substance. So
Yeah.
it's not that your immune system's weak. It's just having this hypersensitive response. It's a little bit too strong for its own good, so to speak. It's a little confused. It thinks things like pollen are parasites, essentially. So this type of immunotherapy we've been doing for a very long time, but one route of doing it a little bit differently that I've heard about, I haven't done it myself, but it's under active investigation, is where we take those allergens and instead of doing an injection just under the skin, we call it a subcutaneous injection. Some allergists are actually actively injecting higher doses right next to lymph nodes in the groin. And the idea is that if we introduce that allergen closer to the immune system where those T and B cells, which are active in making these types of allergic responses and developing more long-term memory to them, it may end up desensitizing the immune system much more quickly and more effectively. So that's under active investigation, but I think that's a really interesting way to pursue this.
Yeah, well, brings up a couple of interesting issues. One getting on kind of research and where things going on research, which I want to hop back to a little bit later. But while we're kind of on that idea of developing tolerance to stuff, I want to slightly shift gears because there's been a lot of talk recently about peanut allergies and how they came and how to try and get over them. And it's interesting there that one of the things that a lot of people are talking about now is like when children are very young, rather than not giving them peanuts, but by starting and giving them a little bit, that helps them to build up some natural resistance to it, and often helps to overcome peanut allergies. I'm kind of curious what your take is on that, and any other kind of initial thoughts you might have on some food allergy issues.
Yeah, so we have seen the number of people developing food allergies rise at a very alarming rate that many people are concerned about, because this can be a potentially lifelong, potentially life-threatening issue for people. And it not only affects them, but affects their family and communities when these issues arise. So we're actively trying to figure out, why is this happening and what can we do to prevent this from happening? And so one of the more recent groundbreaking discoveries that we had was something called the LEAP study, Learning Early About Peanut, where they randomized infants into either starting to consume peanut proteins essentially before the first, before 12 months old, and then another group waited until they were 5 years old. And they found that the children who were eating the peanut protein regularly had a roughly 80% less likely chance that they would develop peanut allergy later in life than if you had delayed it several years. And this goes against what the guidelines were and the recommendations were at the time, which was, peanuts are a highly allergenic substance. The immune system may not be able to tolerate this early in life. Let's delay it. And so that is one paradigm shift that's happened over the last several years that has been helpful, but it's not explaining the whole story, because we're still seeing rising number of cases of food allergies, not just in children, but in adults. So there's got to be other issues involved that we don't fully understand at this time. So a couple of examples of associations that we have seen, it doesn't necessarily mean that it's causative, is mothers who have C-sections, their babies tend to have more food allergies. And maybe that has to do with the fact that if the baby's not born through the birth canal, they're not getting that exposure of bacteria from mom that would help populate their gut. There's a whole area of research called the gut microbiome, where they're looking at trillions of data points and all these bacteria that live in your gut in a healthy ecosystem to try to process the food proteins. And if you don't have that potential environment that is conducive towards tolerance towards foods, you may be more likely to develop food allergies. That's a possibility. Yeah. We also give antibiotics to babies to help save their lives, especially if there's risk for sepsis, as an example, which can be life-threatening and permanently disabling. But when you take antibiotics, it may disrupt that gut microbiome and potentially increase the risk of developing food allergy. And we see that with babies who develop acid reflux. If they take antacids, that association is seen there as well. But again, none of these issues on their own is the reason why we're having this problem. There's multiple issues at play. There's probably some environmental factors that we have yet to discover, and it's an area of research that is really, really important for society lately.
Yeah. Well, that's interesting. A lot of important stuff going on. So I'm curious what your take is then. A lot of people, a lot of families, mothers are worried about their kids. They're saying, should I be testing my kids for food sensitivity and allergies? I mean, is that something that you're recommending now, or what's your position on that?
Not necessarily. So the issue with testing is that the clinical history, and this is true of any issue, it's not just allergy, but I think anything that comes to medicine, you have to be able to convince me as a physician that it's important to get this test. I have to have the story that justifies getting it. And a lot of people, if they just get panels of testing, right, it doesn't necessarily help. And the reason is that when you get a test that's positive, all that's measuring is the antibody that could potentially bind to the food and could potentially cause a problem. But there are many reasons why just having the antibody alone does not mean that you're allergic. You could have that antibody floating around and never react. And there are many people who are like that. So I often tell my families when I see them that if we were to test every single person in the room, even if we didn't have food allergies, at least one of us would test positive for something. That does not mean that it's actually relevant. And so I want to avoid overdiagnosing food allergies, which can be a problem. I have seen some of that in the past, and I want to make sure that people understand the risks and benefits of getting a test like a food allergy test versus the risks and benefits of consuming that food that they're concerned about. And yes, we should be concerned that there's rising rates of food allergies, but part of combating that is making sure that we address this issue early in life in a meaningful, thoughtful way.
Right. Okay, very interesting. I always like to mix it up a little bit with at least one wild card. So I was reading the other day that there may be some link between poison ivy and sensitivity to mangoes. Is there something there that normally I wouldn't associate my poison ivy with mangoes, but is...
Yeah, that's a fantastic question. So it brings up an issue regarding food allergies called cross-reactivity. And this is true also for other allergens. So the idea is that your immune system, when it's going to respond to a foreign substance, it will bind and detect a specific part of the protein structure. And certain substances have similar protein structures on parts of the protein, even though they're two distinct substances, right? So in poison ivy, what gets you sick is urushiol, and there's a similar substance that's found on mangoes as well. So many people who have an allergy to poison ivy end up having this cross-reactivity or cross-reaction to mangoes because of that.
Is there anything else that has that same kind of cross reaction with the poison ivies?
Cashews can potentially as well.
Yeah, interesting. Okay, going to shift gears once again. I think it was last week or maybe the week before. You uncovered something that I thought was absolutely wonderful. The HHS Tracking Accountability in Government Grant System. So obviously, we've all been really shocked by the talk of the cuts by HHS on research, we see the potential impact of some of these research cuts is going to be significant. I mean, you were talking about some really interesting new research that's going on. I'm curious from your perspective, do the cuts that HHS is talking about now, do they concern you? And is there particular areas of research that you're most concerned about?
These cuts are pretty much across the board and are very concerning to me. I mean, I could list so many different areas that have been affected, and I think the one that the audience who's listening may, gravitate towards a lot is what we're hearing about with this measles outbreak, right? So in Texas, we have probably a lot more cases than what's being reported. But nationally, we have over 600 cases, right? And a second child, as of recording this, recently passed away due to measles. They were not vaccinated, right? One of the funding cuts that happened recently went towards, it was initially deemed as COVID-19 relief, but a lot of those funds were being reallocated towards addressing other issues like the measles outbreak. And so Dallas County, which is near where the epicenter of this outbreak is occurring, was supposed to have over 50 free measles vaccination clinics that were going to be up and running, that anybody could come in and get a free vaccine. Because a lot of people can't afford vaccines. And this funding cuts essentially closed down over 50 clinics that is right in the area where there's lower vaccination rates. And even in that area, I just found out recently there was a measles exposure at a Great Wolf Lodge. And if you haven't heard of one of those places before, it's a very large resort, indoor water park with games and all sorts of events that is very kid friendly. But there was an individual who was infected, who was likely infectious, that went there from March 28th through March 30th. So several days that could have exposed hundreds of people, if not thousands, and you don't know how many of them weren't vaccinated or potentially were, but they weren't immune, because no vaccine is really 100% effective, but the effectiveness increases as you get more people vaccinated. So there's many people who are going to be exposed, and we won't know the fallout from that for at least another 2 to 3 weeks, because the virus is very slow growing and you don't develop symptoms right away. And so having those federal cuts to programs that were meant to give out free vaccines to stop an outbreak, to help lower the number of kids getting hospitalized, to reduce the chances of death. Measles is no joke. This is a virus that can hospitalize about 1 in 5 cases. So even if you were to vaccinate just 6 or 7 people, you're right there going to save tens of thousands of dollars in medical fees. And so an ounce of prevention is worth a pound of cure when it comes to these types of issues. And so that's just one of many issues that concerns me about what's happening with these cuts.
Yeah, all right. Our recent HealthDay Harris Poll survey looked into vaccine hesitancy, which is obviously a related issue here. And we were asking where people get their information to help shape their decisions about whether they should be vaccinated or not. And we were pleasantly encouraged to hear that close to 80% of the respondents said that the first place they turn for information is their healthcare providers. You know, as a healthcare provider, as a pediatrician, I'm curious, how do you talk to the vaccine hesitant about the needs and the importance for vaccine? How do you put it in context? How do you help them get over some of the hesitancy that they may have?
Right. So it's really important to come at it from a place of empathy and understanding that oftentimes people are just trying to help their families and do whatever they can that they think is right. But there's a lot of incorrect information out there, or we call that misinformation, that's being spread either, by accident or it's purposeful. So we call that disinformation, when people are purposely spreading that type of information. So I come at it from a lens of saying, I want them to tell me what are their thoughts and concerns about vaccination. And you get a whole range of responses. And so based on that allows me to guide the conversation towards giving them a better understanding about what vaccines are, what are their risks and benefits with it, because no choice that you make in life is without risk. There's always consequences to doing something, not doing something, or choosing a third option. And that's what informed consent is. And by law, we give out vaccine information sheets that has all of the information. But it's also good to put that into context. And also, I think it helps when you can come from it from a place of saying, look, physicians, we vaccinate our children. This is something we don't hesitate to do. And if we had concerns about it, we wouldn't be doing this.
Right. Thank you very much. And I understand that, in fact, your father as well is a physician, and that's why I suppose he was the one who was vaccinating you. So I guess you've learned, and we'll carry that tradition on.
Absolutely.
So I've kept you for a long time today. This was a tremendous amount of incredibly useful information. Really appreciate you taking the time. I mean, there's a lot of stuff out there, as you say, misperceptions about a lot of issues. It's great to have people out there like you who are helping to keep the record straight and who do it do it so well. So thank you very much for taking the time. Thank you for joining us, and hope to have the opportunity to talk with you again soon.
Absolutely. It was a pleasure talking with you. Thanks for having me.